Question 1. Risk assessment procedures indicate that during a routine quality assurance check, a significant deviation was identified in the delivered dose for a patient's radiotherapy treatment, specifically a 5% underdose in a critical planning target volume. The treatment machine log shows no alarms were triggered, and the physicist involved recalls no unusual circumstances during the treatment delivery. The department is under pressure to maintain patient throughput. What is the most appropriate immediate course of action to ensure patient safety and comply with ESTRO accreditation principles for incident reporting and analysis? Option A. Report the incident through the established institutional incident reporting system. Initiate a root cause analysis to identify contributing factors and implement corrective actions based on the findings. Option B. Adjust the treatment plan for subsequent fractions to compensate for the underdose and instruct the staff to be more vigilant during future treatment deliveries. Option C. Inform the patient of the underdose and allow them to decide whether to proceed with further treatment or seek an alternative, while the department continues with other scheduled treatments. Option D. Immediately replan and retreat the patient to correct the underdose and document the event internally for potential future review if similar issues arise. Correct answer is D. Immediately replan and retreat the patient to correct the underdose and document the event internally for potential future review if similar issues arise. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology departments, a near-miss incident involving a critical treatment parameter. The professional challenge lies in balancing the immediate need to ensure patient safety and treatment accuracy with the imperative to conduct a thorough, non-punitive investigation that fosters a culture of learning and improvement. The pressure to quickly resume normal operations must not compromise the systematic analysis required by the European Society for Therapeutic Radiology and Oncology, ESTRO, accreditation guidelines, which emphasize learning from errors and near misses to prevent future occurrences. Correct approach analysis. The correct approach involves a multifaceted response aligned with ESTRO principles for quality assurance and incident reporting. This includes immediate verification of the patient's treatment plan and delivery, followed by a structured incident reporting process. The report should detail the event, its potential impact, and the contributing factors. Crucially, it must trigger a root cause analysis, RCA, or a similar systematic investigation to identify underlying systemic issues, not just individual errors. The findings from this analysis should then inform the development and implementation of corrective and preventive actions, with a plan for monitoring their effectiveness. This approach embodies ESTRO commitment to continuous improvement, patient safety, and the creation of a robust safety culture where reporting is encouraged and learning is prioritized. Incorrect approaches analysis, focusing solely on immediate correction without reporting and analysis, fails to meet ESTRO requirements for incident management. This approach neglects the opportunity to identify systemic weaknesses that could lead to similar or more severe incidents in the future. It also undermines the principle of a learning healthcare system. Attributing the incident solely to human error without investigating contributing system factors is a common but flawed approach. ESTRO guidelines advocate for understanding the context in which errors occur, recognizing that human performance is influenced by system design, workload, training, and other environmental factors. A purely blame-oriented approach discourages reporting and hinders effective problem-solving. Implementing corrective actions without a thorough analysis of the root cause is inefficient and unlikely to prevent recurrence. It may address a symptom rather than the underlying problem, leading to wasted resources and continued risk. This demonstrates a lack of systematic quality improvement as mandated by accreditation bodies. Professional reasoning. Professionals facing such a situation should follow a structured decision-making process. 1. Prioritize immediate patient safety. Ensure the patient's treatment is accurate and safe. 2. Initiate the formal incident reporting procedure. Document the event accurately and promptly according to institutional policy, which should align with ESTRO guidelines. 3. Engage in systematic analysis. Participate in or initiate a root cause analysis to understand all contributing factors, both human and systemic. 4. Develop and implement corrective and preventive actions. Based on the RCA findings, create actionable steps to mitigate risks. 5. Monitor and evaluate. Track the effectiveness of implemented actions and update procedures as necessary. This process ensures that incidents are not just addressed but are used as opportunities for organizational learning and improvement, a cornerstone of ESTRO accreditation. Question 2. Quality control measures reveal that a radiation oncology department's protocols for treating a specific type of cancer have not been updated in 5 years, despite significant advancements in radiation therapy techniques and a growing body of research published in peer-reviewed journals during that period. Which of the following represents the most appropriate professional response to ensure compliance with the principles of the European Society for Therapeutic Radiology and Oncology accreditation and certification regarding the role of radiation therapy in cancer treatment? Option A. Immediately implement the newest, most technologically advanced treatment techniques reported in recent publications, regardless of their established efficacy or integration into existing quality assurance frameworks. Option B. Continue to follow the existing protocols, as they have been effective in the past, and any changes could introduce unforeseen risks or complexities. Option C. Initiate a comprehensive review of current literature and ESTRO guidelines to identify evidence-based updates and best practices, followed by a structured process to integrate these into departmental protocols after multidisciplinary team consensus and appropriate training. Option D. Prioritize patient requests for experimental or novel treatments over established protocols, provided the patient expresses informed consent, to foster a patient-centered approach. The correct answer is C. Initiate a comprehensive review of current literature and ESTRO guidelines to identify evidence-based updates and best practices, followed by a structured process to integrate these into departmental protocols after multidisciplinary team consensus and appropriate training. Explanation. Scenario analysis. This scenario presents a challenge in ensuring that the role of radiation therapy in cancer treatment aligns with the latest evidence-based practices and the stringent quality standards mandated by the European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation. The difficulty lies in balancing established protocols with emerging research and technological advancements, requiring a nuanced understanding of how to integrate new knowledge without compromising patient safety or treatment efficacy. Professionals must exercise careful judgment to determine when and how to adapt treatment paradigms within the established regulatory framework. Correct approach analysis. The correct approach emphasizes the critical role of ongoing professional development and the systematic integration of new evidence into clinical practice. This aligns with ESTRO commitment to promoting excellence in radiation oncology through continuous learning and the adoption of best practices. By actively reviewing and incorporating updated guidelines and research findings, healthcare professionals ensure that the radiation therapy provided is not only compliant with current standards, but also reflects the most effective and safest treatment modalities available, thereby upholding the highest quality of patient care as expected by ESTRO accreditation. Incorrect approaches analysis. One incorrect approach involves adhering strictly to historical treatment protocols without considering recent advancements. This fails to meet ESTRO implicit requirement for continuous improvement and evidence-based practice, potentially leading to suboptimal patient outcomes and a failure to provide the most current and effective care. It represents a stagnation in professional development and a disregard for the evolving landscape of radiation oncology. Another incorrect approach is the uncritical adoption of new technologies or techniques without rigorous evaluation or validation within the ESTRO framework. This can lead to the implementation of treatments that are not yet proven to be safe or effective, or that do not align with the established quality assurance and accreditation standards. It bypasses the necessary due diligence required to ensure that any change enhances, rather than compromises, the quality of radiation therapy. A further incorrect approach is to prioritize patient preference for novel treatments over established, evidence-based protocols without a thorough multidisciplinary discussion and risk-benefit analysis. While patient-centered care is important, it must be balanced with the professional responsibility to provide treatments that are demonstrably safe and effective according to the highest standards of the field, as guided by ESTRO principles. This approach risks offering unproven or potentially harmful interventions. Professional reasoning. Professionals should adopt a systematic approach to integrating new knowledge. This involves actively participating in continuing professional development, critically appraising new research, consulting multidisciplinary teams, and referencing ESTRO guidelines and recommendations. When considering changes to treatment protocols, a thorough review of the evidence, potential benefits, risks, and resource implications is essential. Decisions should be documented and aligned with institutional policies and ESTRO accreditation requirements, ensuring that all patient care adheres to the highest standards of quality and safety. Question 3. Consider a scenario where during the quality assurance check of a new treatment planning system's Phantom, a radiation therapist observes an unexpected discrepancy in the calculated dose distribution compared to expected values, potentially related to how the Phantom material interacts with the treatment beam's radiation. What is the most appropriate course of action according to the European Society for Therapeutic Radiology and Oncology Accreditation and Certification Framework? Option A. Make subjective adjustments to the treatment planning system's parameters to force the calculated dose to match the expected values. Option B. Proceed with the treatment plan validation, assuming the discrepancy is a minor anomaly within acceptable tolerances for Phantom measurements. Option C. Immediately consult with a qualified medical physicist to investigate the nature of the radiation interaction with the Phantom material and its impact on dose calculation. Option D. Ignore the discrepancy, attributing it to a temporary system glitch, and continue with the standard quality assurance procedures. The correct answer is C. Immediately consult with a qualified medical physicist to investigate the nature of the radiation interaction with the Phantom material and its impact on dose calculation. Explanation: this scenario presents a professional challenge because it requires a therapist to balance the immediate need for accurate patient treatment planning with the potential, albeit low, risk of unintended radiation interactions with matter that could affect the accuracy of the treatment delivery. The European Society for Therapeutic Radiology and Oncology, ESTRO, Accreditation and Certification Framework emphasizes patient safety and the quality of care, which necessitates a thorough understanding of radiation physics and its interaction with biological tissues and treatment equipment. Professionals must exercise careful judgment to ensure that all aspects of treatment delivery are optimized and validated. The correct approach represents best professional practice because it directly addresses the ESTRO guidelines concerning quality assurance and the understanding of radiation physics. By consulting with a qualified medical physicist, the therapist ensures that any potential anomalies in radiation interaction with matter, such as unexpected scattering or attenuation within the treatment planning system's Phantom or the patient's anatomy, are identified and accounted for. This proactive consultation aligns with the ESTRO commitment to evidence-based practice and the rigorous validation of treatment plans, ultimately safeguarding patient outcomes and maintaining the integrity of the radiation therapy process. An incorrect approach that involves proceeding with treatment without further investigation fails to uphold the ESTRO commitment to patient safety and quality assurance. This oversight could lead to a suboptimal or inaccurate dose delivery, potentially compromising treatment efficacy or increasing the risk of side effects. Another incorrect approach, such as assuming the observed anomaly is insignificant without expert consultation, demonstrates a lack of due diligence and a disregard for the fundamental principles of radiation physics as applied in therapeutic oncology. This can be seen as a failure to adhere to the ESTRO emphasis on a comprehensive understanding of radiation matter interactions and their clinical implications. Finally, an approach that involves making arbitrary adjustments to the treatment plan without a clear understanding of the underlying physical phenomenon is unprofessional and directly contravenes the ESTRO requirement for evidence-based decision-making and rigorous quality control. The professional decision-making process in such situations should involve a systematic approach. First, recognize and document any observed anomaly. Second, consult relevant ESTRO guidelines and literature pertaining to radiation matter interactions. Third, engage with a qualified medical physicist for expert analysis and validation. Fourth, based on the expert assessment, determine the appropriate course of action, which may involve replanning, re-verification, or proceeding with confidence. And finally, document all steps taken and the rationale behind the final decision. Question 4. The investigation demonstrates a scenario where a patient presents with a locally advanced, previously treated squamous cell carcinoma of the head and neck, with evidence of regional lymph node involvement. The multidisciplinary team is considering the optimal next step in management, weighing the potential benefits and risks of further radiation therapy interventions. Which of the following approaches best reflects adherence to ESTRO accreditation standards for managing such a complex case? Option A. Proceeding with a high-dose rate brachytherapy implant to the primary tumor site, irrespective of the extent of nodal involvement or prior radiation dose. Option B. Initiating a discussion to evaluate the feasibility and potential benefit of re-irradiation with external beam therapy, considering dose constraints and potential toxicity, or exploring brachytherapy if anatomically feasible, alongside a review of systemic therapy options with the medical oncologist. Option C. Re-irradiating the primary site and involved lymph nodes with a hypofractionated external beam radiation therapy regimen, assuming prior treatment was delivered with conventional fractionation. Option D. Recommending palliative systemic therapy alone, without further consideration of local or regional radiation interventions, due to the history of prior radiation. The correct answer is C. Re-irradiating the primary site and involved lymph nodes with a hypofractionated external beam radiation therapy regimen, assuming prior treatment was delivered with conventional fractionation. Explanation. Scenario analysis. This scenario presents a common implementation challenge in radiation oncology, selecting the most appropriate radiation therapy modality for a patient with a complex presentation. The challenge lies in balancing the efficacy of different treatment types with patient-specific factors, potential toxicities, and the need for precise delivery, all within the framework of the European Society for Therapeutic Radiology and Oncology, ESTRO accreditation standards. ESTRO accreditation emphasizes evidence-based practice, patient safety, and quality assurance, requiring a thorough understanding of the strengths and limitations of each modality. Correct approach analysis. The correct approach involves a multidisciplinary team discussion that critically evaluates the tumor characteristics, stage, location, histology, patient's overall health, and previous treatments. This collaborative process ensures that the chosen modality aligns with the latest ESTRO guidelines and evidence-based recommendations for the specific cancer type. For instance, if the patient has a localized, early-stage tumor amenable to precise dose delivery with minimal surrounding organ at risk involvement, external beam radiotherapy (EBIT), with advanced techniques like intensity-modulated radiation therapy (IMiT) or volumetric modulated arc therapy (VMAT), might be preferred for its ability to shape the dose distribution. If the tumor is in a location where a high dose can be delivered directly to the target while sparing surrounding tissues, or if a boost is required, brachytherapy might be considered. Systemic therapy, such as hormonal therapy or chemotherapy, is often used in conjunction with or as an alternative to radiation, particularly for metastatic disease or to sensitize tumors to radiation. The decision must be documented, justified, and communicated to the patient. Incorrect approaches analysis. An approach that solely prioritizes the modality with the highest reported cure rates in general literature, without considering the specific patient's case and the nuances of ESTRO guidelines, is professionally unacceptable. This ignores the principle of personalized medicine and can lead to suboptimal outcomes or unnecessary toxicity. An approach that defaults to a single modality, e.g., always recommending EBIT for all solid tumors, without a thorough evaluation of alternatives like brachytherapy or systemic therapy, demonstrates a lack of comprehensive knowledge and adherence to ESTRO emphasis on exploring all appropriate treatment options. This can be a failure in quality assurance and patient-centered care. An approach that neglects to involve relevant specialists, e.g., medical oncologists, surgeons, physicists, in the decision-making process for complex cases violates ESTRO principles of multidisciplinary care and can lead to fragmented or incomplete treatment planning. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a comprehensive review of the patient's medical history, imaging, and pathology. This should be followed by a thorough understanding of the indications, contraindications, benefits, and risks of each relevant radiation therapy modality, external beam, brachytherapy, systemic therapy, as outlined by ESTRO guidelines and current evidence. A multidisciplinary tumor board discussion is crucial for complex cases, allowing for diverse perspectives and a consensus-driven treatment plan. Finally, clear communication with the patient regarding the rationale for the chosen treatment, its expected outcomes, and potential side effects is paramount. Question 5. Upon reviewing the simulation and treatment planning process for a new patient requiring complex radiotherapy, a radiation oncologist, a medical physicist, and a radiation therapist are discussing the next steps to ensure compliance with European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation standards. Which of the following approaches best reflects the required due diligence for ESTRO accreditation concerning treatment planning and simulation techniques? Option A. The entire simulation and planning process is expedited to meet departmental throughput targets, with quality assurance checks performed only if time permits. Option B. The radiation therapist, having extensive experience with the planning system, completes the simulation and planning process independently, with only a cursory review by the medical physicist. Option C. The planning system's automated checks are deemed sufficient, and the treatment plan is approved for delivery after a brief review by the radiation oncologist, bypassing independent verification steps. Option D. The medical physicist independently verifies all simulation parameters and dose calculations, and then the radiation oncologist reviews the final plan for clinical appropriateness before treatment delivery. The correct answer is D. The medical physicist independently verifies all simulation parameters and dose calculations, and then the radiation oncologist reviews the final plan for clinical appropriateness before treatment delivery. Explanation. This scenario presents a professional challenge because it requires balancing the established accreditation standards of the European Society for Therapeutic Radiology and Oncology (ESTRO) with the practical realities of patient care and evolving technological capabilities. The core of the challenge lies in ensuring that treatment planning and simulation techniques not only meet the stringent requirements for accreditation, but also uphold the highest ethical standards of patient safety and efficacy. Careful judgment is required to interpret and apply ESTRO guidelines in a way that is both compliant and clinically sound. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary review of the simulation and planning process, directly aligning with ESTRO emphasis on quality assurance and continuous improvement. This approach ensures that all aspects of the treatment pathway, from initial imaging to dose calculation, are scrutinized by individuals with relevant expertise. This aligns with ESTRO commitment to standardized, high-quality radiotherapy, promoting patient safety and optimal treatment outcomes through rigorous verification and validation. An incorrect approach that relies solely on the physicist's verification without involving the radiation oncologist fails to meet ESTRO implicit requirement for a holistic review of treatment plans. This oversight can lead to a disconnect between the technical plan and the clinical intent, potentially compromising treatment efficacy or patient safety. Ethically, it represents a failure to ensure that the treatment plan accurately reflects the physician's prescription and the patient's specific clinical needs. Another incorrect approach that bypasses independent verification of the treatment plan, assuming the planning system's algorithms are infallible, is a significant regulatory and ethical failure. ESTRO accreditation mandates robust quality assurance procedures, which include independent checks to mitigate the risk of systematic errors in software or human input. This approach demonstrates a lack of due diligence and a disregard for established safety protocols, potentially exposing patients to incorrect radiation doses. A further incorrect approach that prioritizes speed over thoroughness by expediting the planning process without adhering to all prescribed quality checks is also professionally unacceptable. This haste can lead to overlooked errors in simulation or planning, directly contravening ESTRO emphasis on meticulousness and accuracy in radiotherapy. Ethically, it prioritizes efficiency over patient well-being, a fundamental breach of professional responsibility. A professional decision-making process for similar situations should involve a systematic evaluation of the ESTRO accreditation requirements, a thorough understanding of the clinical context, and a commitment to a multidisciplinary approach. Professionals should always advocate for processes that ensure patient safety, treatment accuracy, and adherence to established quality standards. When faced with potential shortcuts or deviation, the decision-making framework should prioritize patient welfare and regulatory compliance, seeking clarification or additional resources when necessary. Question 6. Quality control measures reveal a consistent observation that the tumor cell population within a specific patient cohort undergoing standard fractionation radiotherapy appears to be predominantly in the radioresistant S phase of the cell cycle. Considering the principles of radiobiology and ESTRO accreditation standards, what is the most appropriate clinical decision-making process to address this finding? Option A. Immediately escalate the radiation dose for all patients in this cohort without further investigation, assuming increased radioresistance necessitates higher doses. Option B. Implement a new, unproven treatment technique for this cohort based on the observed cell cycle phase, bypassing standard ESTRO review and approval processes. Option C. Evaluate the potential for modifying the fractionation schedule, or dose per fraction, to exploit the varying radiosensitivity of different cell cycle phases, in conjunction with a review of relevant radiobiological literature and ESTRO guidelines. Option D. Conclude that cell cycle variations are inherent to tumor biology and do not warrant any changes to the established treatment protocols, as per standard ESTRO practice. The correct answer is C. Evaluate the potential for modifying the fractionation schedule, or dose per fraction, to exploit the varying radiosensitivity of different cell cycle phases, in conjunction with a review of relevant radiobiological literature and ESTRO guidelines. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the radiation oncology team to interpret quality control findings in the context of radiobiology, specifically the relationship between the cell cycle and radiation sensitivity, to ensure optimal treatment delivery and patient outcomes. The challenge lies in translating a technical observation into a clinically relevant decision that impacts treatment planning and execution, adhering strictly to the European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation and certification guidelines. Misinterpretation or inaction could lead to suboptimal dose delivery, potentially affecting treatment efficacy and increasing the risk of side effects, thereby compromising the standards expected by ESTRO. Correct approach analysis. The correct approach involves recognizing that different phases of the cell cycle exhibit varying sensitivities to radiation. The G2 and M phases are generally more radiosensitive, while the S phase is more radioresistant. If quality control indicates a potential shift in the tumor cell population towards more radioresistant phases, or if the treatment schedule is not optimized to target the more sensitive phases, the team must consider adjustments. This might involve modifying the fractionation schedule, or dose per fraction, to better exploit the radiosensitivity of the tumor cells at specific points in their cycle. Aligning with ESTRO emphasis on evidence-based practice and continuous quality improvement in radiation oncology, this approach demonstrates a deep understanding of radiobiological principles and their practical application, which is a cornerstone of ESTRO accreditation. Incorrect approaches analysis. One incorrect approach would be to dismiss the quality control findings as purely technical and unrelated to clinical treatment, without considering the radiobiological implications. This fails to meet ESTRO standards for integrated quality management, which mandates the consideration of all factors influencing treatment efficacy. Another incorrect approach would be to make arbitrary changes to the treatment plan without a clear radiobiological rationale, or without consulting relevant literature and ESTRO guidelines. This demonstrates a lack of systematic decision-making and could lead to unintended consequences, violating the principle of evidence-based practice. Furthermore, failing to document the rationale for any treatment adjustments or to reevaluate the impact of such changes would be a significant breach of ESTRO requirements for record-keeping and quality assurance. Professional reasoning. Professionals facing such a scenario should employ a systematic decision-making framework. First, thoroughly review the quality control data and understand its potential implications for tumor cell radiosensitivity. Second, consult relevant radiobiological literature and ESTRO guidelines pertaining to cell cycle effects and radiation therapy. Third, discuss the findings and potential treatment modifications with the multidisciplinary team, including radiation oncologists, medical physicists, and dosimetrists. Fourth, if adjustments are deemed necessary, meticulously document the rationale, the proposed changes, and the expected impact. Finally, implement the changes and establish a plan for reevaluation to ensure the desired outcome is achieved, thereby upholding the highest standards of patient care and ESTRO accreditation. Question 7. Examination of the data shows that the historical development of radiation therapy has progressed through several distinct phases, from early empirical observations to sophisticated image-guided techniques. When preparing for ESTRO accreditation, which aspect of this historical evolution is most critical for demonstrating compliance with current standards? Option A. The biographical details of pioneering scientists and their initial discoveries of radioactive isotopes without explicit connection to current clinical application. Option B. The chronological timeline of major technological advancements in radiation delivery, listed without an explanation of how these advancements have been integrated into current quality control frameworks. Option C. The theoretical physics behind early radiation interactions with matter, presented without reference to how these theories have been refined to improve treatment planning accuracy. Option D. The evolution of radiation protection principles and dosimetry standards, directly influencing current safety protocols and quality assurance measures mandated by ESTRO. Correct answer is D. The evolution of radiation protection principles and dosimetry standards, directly influencing current safety protocols and quality assurance measures mandated by ESTRO. Explanation. The scenario presents a challenge in applying historical understanding of radiation therapy's evolution to current accreditation requirements, specifically within the European Society for Therapeutic Radiology and Oncology (ESTRO) framework. The difficulty lies in discerning which historical developments are directly relevant to modern accreditation standards and which are purely academic. ESTRO accreditation focuses on current best practices, safety, and quality assurance, meaning historical context must be framed through its impact on these contemporary elements. The correct approach recognizes that ESTRO accreditation, while rooted in scientific advancement, prioritizes demonstrable adherence to current standards. Therefore, understanding the historical development of radiation therapy is crucial only insofar as it informs the rationale behind current protocols, safety measures, and technological advancements that are subject to accreditation. This approach aligns with ESTRO's objective of ensuring high-quality patient care through standardized, evidence-based practices. It requires professionals to connect historical milestones to their present-day implications for patient safety, treatment efficacy, and quality control, which are the core tenets of accreditation. An incorrect approach would be to focus on historical figures or purely theoretical advancements, without linking them to tangible impacts on current practice or accreditation criteria. For instance, detailing the discovery of radiation without explaining how this discovery led to the development of safety protocols or dosimetry standards that are now mandated by ESTRO would be a failure. Similarly, discussing early, less precise treatment techniques without acknowledging their evolution into the sophisticated, quality-assured methods of today would miss the point of accreditation. Such approaches fail to demonstrate an understanding of how the past informs the present regulatory and accreditation landscape, potentially leading to a superficial grasp of the principles ESTRO seeks to uphold. This can result in a failure to adequately justify current practices or identify areas for improvement based on historical lessons learned, which is a direct contravention of the spirit of continuous quality improvement inherent in accreditation. The professional decision-making process should involve critically evaluating historical information through the lens of current ESTRO accreditation standards. Professionals must ask, how did this historical development influence current safety regulations, treatment planning methodologies, or quality assurance procedures that are now assessed by ESTRO? This analytical framework ensures that historical knowledge is applied practically to meet accreditation requirements, rather than being treated as an academic exercise. Question 8. Performance analysis shows that a significant proportion of patients treated for locally advanced solid tumors exhibit suboptimal local control rates, which preliminary investigations suggest may be linked to tumor hypoxia. Considering the European Society for Therapeutic Radiology and Oncology accreditation and certification framework, what is the most appropriate next step for the Radiation Oncology Department to address this potential issue? Option A. Immediately adopt a novel investigational hypoxia-targeting drug used in a recent publication from a leading international center without further internal validation or review. Option B. Initiate a comprehensive review of current evidence and institutional protocols regarding tumor hypoxia and its modulation in radiation therapy, followed by a multidisciplinary discussion to determine evidence-based strategies for implementation. Option C. Continue with current treatment protocols, assuming that existing techniques are sufficient, and focus resources on other areas of quality improvement. Option D. Implement a new hypoxia imaging technique based on anecdotal reports of its effectiveness, without formal validation or integration into treatment planning. The correct answer is B. Initiate a comprehensive review of current evidence and institutional protocols regarding tumor hypoxia and its modulation in radiation therapy, followed by a multidisciplinary discussion to determine evidence-based strategies for implementation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the radiation oncology team to balance the known detrimental effects of tumor hypoxia on treatment efficacy with the practical limitations and potential toxicities of implementing hypoxia-modulating strategies. The accreditation and certification framework emphasizes evidence-based practice and patient safety, necessitating a thorough understanding of both the scientific rationale and the clinical applicability of such interventions. Correct approach analysis. The correct approach involves a systematic review of current evidence and institutional guidelines to determine the most appropriate and evidence-based strategy for addressing tumor hypoxia in the context of radiation therapy. This aligns with the European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation principles, which mandate adherence to best practices and continuous quality improvement. Specifically, it requires the team to evaluate whether existing protocols adequately account for hypoxia or if novel strategies, supported by robust clinical data and institutional review, are warranted. This ensures that any intervention is both scientifically sound and clinically justifiable, prioritizing patient outcomes and safety within the established regulatory framework. Incorrect approaches analysis. Implementing a novel hypoxia targeting agent without prior institutional review or robust clinical trial data represents a significant regulatory and ethical failure. This bypasses established safety protocols and the rigorous evaluation required by accreditation bodies, potentially exposing patients to unproven risks and compromising the quality of care. It violates the principle of evidence-based medicine and the responsibility to ensure that all treatment modalities have undergone appropriate validation. Relying solely on anecdotal evidence or the practices of other institutions without critical appraisal of their applicability, the local patient population and resource availability, is also professionally unacceptable. This approach lacks the systematic evaluation and institutional endorsement required by ESTRO guidelines, potentially leading to suboptimal or even harmful treatment decisions. It fails to uphold the commitment to individualized patient care and evidence-based decision-making. Ignoring the potential impact of hypoxia on treatment outcomes due to perceived complexity or lack of immediate solutions is a failure to adhere to the core principles of radiation oncology. ESTRO accreditation implicitly requires a proactive approach to optimizing treatment efficacy, which includes addressing known radiobiological challenges like hypoxia. This passive stance can lead to undertreatment and poorer patient outcomes. A direct contravention of the accreditations aim to ensure high-quality patient care. Professional reasoning. Professionals should approach this situation by first understanding the ESTRO accreditation requirements related to treatment optimization and evidence-based practice. They should then consult internal quality assurance committees and multidisciplinary tumor boards to review the current literature on hypoxia and its impact on radiation therapy outcomes for the specific tumor sites treated. This should be followed by an assessment of existing institutional protocols to determine if they adequately address hypoxia. If gaps are identified, a structured process for evaluating and potentially implementing new strategies, including pilot studies or adherence to established clinical trials, should be initiated. This systematic, evidence-driven, and institutionally approved approach ensures patient safety and aligns with the highest standards of professional practice and regulatory compliance. Question 9. Cost-benefit analysis shows that a novel hypofractionation schedule for a specific tumor site could potentially reduce treatment duration and associated healthcare resource utilization. However, the biological implications of this altered fractionation pattern on tumor control and late normal tissue toxicity are not fully established within the existing literature. Considering the European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation requirements, which of the following approaches best aligns with best professional practice? Option A. Implement the novel hypofractionation schedule immediately due to the clear cost and resource benefits assuming that any potential increase in toxicity will be manageable. Option B. Proceed with the novel hypofractionation schedule for all eligible patients, relying on the expertise of the treating radiation oncologist to adjust treatment parameters as needed based on individual patient response. Option C. Conduct a thorough review of existing radiobiological principles and relevant preclinical and clinical data on hypofractionation for similar tumor sites. Engage in multidisciplinary team discussions to assess potential risks and benefits, and consider prospective data collection to evaluate outcomes before widespread adoption. Option D. Reject the novel hypofractionation schedule outright, as any deviation from established, validated fractionation protocols carries an unacceptable risk, regardless of potential benefits. The correct answer is A. Implement the novel hypofractionation schedule immediately due to the clear cost and resource benefits, assuming that any potential increase in toxicity will be manageable. Explanation. This scenario is professionally challenging because it requires balancing the potential benefits of a novel fractionation schedule against established evidence-based practices and the accreditation requirements of the European Society for Therapeutic Radiology and Oncology (ESTRO). The core tension lies in the potential for improved patient outcomes or reduced treatment burden versus the risks associated with deviating from validated protocols, particularly concerning late toxicity and long-term efficacy. ESTRO accreditation emphasizes adherence to quality standards, patient safety, and evidence-based medicine. Therefore, any proposed change must be rigorously justified and demonstrably safe and effective, aligning with the principles of good clinical practice and the ethical imperative to provide the best possible care. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based decision-making, which are fundamental tenets of ESTRO accreditation and ethical oncology practice. By consulting relevant literature, considering biological plausibility, and engaging in multidisciplinary discussion, the team ensures that any proposed deviation from standard fractionation is thoroughly evaluated for its potential impact on both tumor control and normal tissue toxicity. This systematic and evidence-driven process minimizes the risk of unintended harm and maximizes the likelihood of achieving optimal therapeutic outcomes, thereby upholding the standards expected for ESTRO accreditation. An incorrect approach that proposes implementing a novel fractionation schedule solely based on anecdotal evidence or a perceived cost-benefit advantage without robust scientific validation would represent a significant regulatory and ethical failure. This would violate ESTRO emphasis on evidence-based practice and quality assurance, potentially exposing patients to unproven risks. Ethically, it breaches the principle of non-maleficence by not adequately assessing potential harms. Another incorrect approach, such as proceeding with the change without multidisciplinary input, would fail to leverage the collective expertise necessary for complex treatment decisions, increasing the risk of overlooking critical factors related to radiobiology, surgical considerations, or medical oncology management. This disregard for collaborative decision-making undermines the quality of care and the comprehensive approach mandated by accreditation bodies. Professionals should employ a decision-making framework that begins with a thorough review of existing evidence and guidelines relevant to the specific cancer type and stage. This should be followed by a critical assessment of the proposed change's biological plausibility, considering radiobiological models and known dose-response relationships. Crucially, any deviation from established protocols should be discussed within a multidisciplinary team, including radiation oncologists, medical physicists, dosimetrists, and potentially medical oncologists and surgeons. If the proposed change shows promise, a plan for prospective data collection and analysis, potentially within a clinical trial framework, should be considered to rigorously evaluate its safety and efficacy before widespread adoption. This structured approach ensures that decisions are informed, safe, and aligned with the highest standards of care and accreditation requirements. Question 10. Analysis of patient diagnosed with localized prostate cancer where both low-dose rate (LDR), brachytherapy, and high-dose rate (HDR) brachytherapy are considered viable treatment options. What is the most appropriate decision-making framework to determine the optimal brachytherapy technique, adhering to the principles of the European Society for Therapeutic Radiology and Oncology accreditation and certification? Option A. Choose the technique that requires the least amount of time for the treatment planning and delivery process, to maximize patient throughput and resource utilization. Option B. Select the technique that the treating radiation oncologist has the most personal experience with, as this generally leads to better outcomes due to familiarity and efficiency. Option C. Opt for the technique that utilizes the most advanced or novel radioactive sources, assuming that newer technology inherently provides superior clinical results. Option D. Prioritize the technique that aligns with the institution's most recently updated ESTRO-accredited treatment protocols for prostate brachytherapy, ensuring all quality assurance measures are met, and document the rationale based on patient-specific factors and clinical evidence. The correct answer is D. Prioritize the technique that aligns with the institution's most recently updated ESTRO-accredited treatment protocols for prostate brachytherapy, ensuring all quality assurance measures are met, and document the rationale based on patient-specific factors and clinical evidence. Explanation. The scenario presents a common challenge in brachytherapy where the choice between low-dose rate, LDR, and high-dose rate, HDR, techniques requires careful consideration of patient-specific factors, tumor characteristics, and the available resources and expertise within an accredited institution. The European Society for Therapeutic Radiology and Oncology, ESTRO, accreditation framework emphasizes adherence to best practices, quality assurance, and patient safety, which are paramount when selecting and implementing brachytherapy techniques. The decision-making process must be guided by established clinical guidelines and the specific accreditation requirements of the institution, ensuring that the chosen technique aligns with the evidence base and provides optimal outcomes for the patient. The correct approach involves a comprehensive evaluation of the patient's clinical presentation, including the stage and histology of the tumor, anatomical location, and any comorbidities that might influence treatment tolerance or efficacy. This evaluation should be conducted by a multidisciplinary team, including radiation oncologists, medical physicists, and dosimetrists, who are all trained and experienced in both LDR and HDR brachytherapy. The decision should be documented thoroughly, justifying the chosen technique based on its established efficacy and safety profile for the specific indication, as supported by clinical evidence and institutional protocols that align with ESTRO accreditation standards. This ensures that the treatment plan is individualized, evidence-based, and delivered with the highest standards of quality and safety. An incorrect approach would be to default to a single technique without a thorough patient-specific assessment, or to choose a technique based solely on convenience or equipment availability without considering the clinical appropriateness. For instance, selecting HDR solely because it is faster to deliver, without considering potential increases in toxicity for certain tumor types or patient anatomies, would be a failure to adhere to best practice. Conversely, choosing LDR when HDR is clinically indicated for better dose conformity and reduced treatment time, potentially leading to suboptimal tumor control, would also be a deviation from best practice. Furthermore, failing to involve the appropriate multidisciplinary team in the decision-making process, or neglecting to document the rationale for the chosen technique, would represent a failure in quality assurance and adherence to the principles of accredited practice, potentially contravening ESTRO guidelines on team collaboration and documentation. The professional reasoning process for such decision should follow a structured approach. 1. Patient and tumor assessment. Thoroughly evaluate all relevant clinical and pathological data. 2. Technique appropriateness. Consider the evidence base for LDR and HDR brachytherapy for the specific tumor site and stage. 3. Resource and expertise evaluation. Confirm that the institution has the necessary equipment, trained personnel, and quality assurance protocols for the chosen technique. 4. Multidisciplinary consultation. Engage all relevant specialists to discuss the case and reach a consensus. 5. Informed consent. Ensure the patient understands the rationale for the chosen technique, its benefits, risks, and alternatives. 6. Documentation. Meticulously record the decision-making process, the rationale, and the treatment plan. 7. Quality assurance. Implement robust QA procedures throughout the treatment delivery process. Question 11. The evaluation methodology shows a radiation oncology department is considering the adoption of a novel intensity-modulated radiation therapy, IMiT, technique for the treatment of locally advanced head and neck squamous cell carcinoma. This technique promises improved dose conformity to the target volume, while potentially sparing critical organs at risk, such as the salivary glands and brainstem. However, the department has limited prior experience with this specific IMiT variant, and the long-term clinical outcomes data are still emerging from early-phase studies. Which of the following approaches best aligns with the principles of ESTRO accreditation for the safe and effective clinical application of this new radiation therapy technique? Option A. Delay the adoption of the new IMiT technique indefinitely until extensive, long-term, multi-center randomized controlled trial data becomes available, even if current evidence suggests potential benefits for specific patient subgroups. Option B. Implement the new IMiT technique immediately for all eligible patients, leveraging the theoretical advantages and assuming similar outcomes to established IMiT protocols, while initiating a retrospective data collection process. Option C. Conduct a thorough review of all available peer-reviewed literature and multi-institutional clinical trial data on this specific IMiT technique, consult with national and international experts, and develop a comprehensive internal quality assurance protocol, including a pilot phase with stringent monitoring before widespread adoption. Option D. Proceed with the new IMiT technique based on the recommendation of a single senior physician who has attended a brief introductory workshop on the method, without formal departmental review or protocol development. The correct answer is B. Implement the new IMiT technique immediately for all eligible patients, leveraging the theoretical advantages and assuming similar outcomes to established IMiT protocols, while initiating a retrospective data collection process. Explanation. The evaluation methodology shows a scenario where a radiation oncology department is considering the implementation of a novel stereotactic body radiation therapy, SBRT, technique for early-stage non-small cell lung cancer, NSCLC. This presents a professional challenge due to the inherent risks associated with SBRT, including potential toxicity to surrounding healthy tissues and the need for precise delivery. The decision-making process requires a thorough understanding of the clinical evidence, patient selection criteria, and the department's capacity to deliver the treatment safely and effectively, aligning with the European Society for Therapeutic Radiology and Oncology, ESTRO, accreditation standards. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based medicine, core tenets of ESTRO accreditation. This involves a comprehensive review of published literature, consultation with multidisciplinary teams, including medical oncologists, pulmonologists, and radiologists, and a rigorous internal quality assurance process. Adherence to ESTRO guidelines on SBRT, which emphasize appropriate patient selection, treatment planning, delivery, and follow-up, ensures that the proposed technique is implemented within a framework that minimizes risk and maximizes potential benefit. This aligns with the ESTRO commitment to promoting high standards of care and patient outcomes in radiation oncology. An incorrect approach that involves immediate adoption of the new technique without sufficient evidence review or quality assurance would represent a significant regulatory and ethical failure. This bypasses the ESTRO requirement for demonstrating competence and safety in new treatment modalities, could lead to suboptimal patient outcomes, increased toxicity, and potential breaches of patient consent due to inadequate risk-benefit assessment. Another incorrect approach, such as relying solely on anecdotal experience or the opinion of a single clinician, fails to meet the ESTRO emphasis on systematic evaluation and evidence-based practice. This neglects the collective expertise and rigorous validation processes expected for accreditation. Furthermore, failing to establish clear protocols for patient selection, treatment planning, and toxicity monitoring would violate ESTRO quality management principles, potentially exposing patients to undue harm and compromising the department's accreditation status. The professional decision-making process for similar situations should involve a structured approach. 1. Evidence appraisal. Critically evaluate the scientific literature supporting the new technique, focusing on efficacy, safety, and generalizability. 2. Multidisciplinary consultation. Engage relevant specialists to discuss patient suitability, potential benefits, and risks. 3. Quality assurance and protocol development. Establish robust internal protocols for patient selection, treatment planning, delivery, and follow-up, including pre-treatment and ongoing quality control measures. 4. Staff training and competency assessment. Ensure all involved personnel are adequately trained and competent in the new technique. 5. Pilot implementation and monitoring. Consider a phased introduction with close monitoring of outcomes and toxicity before widespread adoption. 6. Continuous improvement. Regularly review outcomes and adapt protocols based on experience and evolving evidence. Question 12. The audit findings indicate that the linear accelerator's output measurement, performed during routine quality control, shows a deviation exceeding the acceptable tolerance limits specified by the European Society for Therapeutic Radiology and Oncology, ESTRO guidelines. What is the most appropriate immediate course of action to ensure patient safety and maintain accreditation standards? Option A. Continue patient treatments as scheduled, but document the deviation and plan for recalibration during the next scheduled maintenance window. Option B. Attempt to recalibrate the linear accelerator internally using the available service manual and the expertise of the senior radiation therapist. Option C. Immediately cease all patient treatments delivered by the affected linear accelerator and arrange for prompt recalibration by a qualified medical physicist. Option D. Rely on the linear accelerator's built-in self-diagnostic system to confirm the deviation and proceed with treatments if the system reports no critical errors. Correct answer is C. Immediately cease all patient treatments delivered by the affected linear accelerator and arrange for prompt recalibration by a qualified medical physicist. Explanation. The audit findings highlight a common challenge in radiation oncology, ensuring the accuracy and reliability of dosimetry and radiation measurement equipment. This scenario is professionally challenging because it directly impacts patient safety and treatment efficacy. Inaccurate measurements can lead to underdosing, treatment failure, or overdosing, unacceptable toxicity. The accreditation body standards are designed to prevent such errors by mandating rigorous quality assurance. The correct approach, which involves immediate cessation of patient treatments using the affected equipment and prompt recalibration by a qualified medical physicist, represents best professional practice. This aligns directly with the European Society for Therapeutic Radiology and Oncology, ESTRO, accreditation guidelines, which emphasize a proactive and safety-first approach to equipment performance. The principle is to prevent any potential harm to patients by immediately removing suspect equipment from clinical use until its accuracy is verified and assured. This demonstrates adherence to the fundamental ethical obligation of do no harm and the regulatory requirement for maintaining equipment within specified tolerances. An incorrect approach would be to continue treatments while scheduling a recalibration at a later date. This is a significant regulatory and ethical failure. It violates the principle of patient safety by knowingly exposing patients to potentially inaccurate radiation doses. Ethically, it prioritizes operational convenience over patient well-being. From a regulatory standpoint, it contravenes the spirit and letter of ESTRO accreditation, which demands immediate action when equipment performance is questionable. Another incorrect approach would be to rely solely on the equipment's internal self-checks without independent verification. While self-checks are a component of quality assurance, they are not a substitute for periodic, independent calibration and measurement by a qualified professional using traceable standards. This approach fails to meet the rigorous standards expected for accredited centers and risks overlooking subtle but clinically significant deviations in dosimetry. It represents a failure to implement a comprehensive quality management system as mandated by accreditation bodies. Finally, an incorrect approach would be to attempt recalibration by an unqualified staff member. This is a critical failure in both regulatory compliance and professional responsibility. ESTRO accreditation requires that all quality assurance procedures, including calibration, be performed by personnel with appropriate qualifications and expertise, typically a medical physicist. Attempting such procedures with insufficient training or certification poses a direct risk to equipment accuracy and consequently patient safety, and would be a clear violation of accreditation standards. The professional decision-making process in such a situation should involve 1. Recognizing the potential impact on patient care. 2. Immediately consulting the relevant ESTRO accreditation guidelines and internal quality assurance protocols. 3. Prioritizing patient safety by halting treatments with the suspect equipment. 4. Engaging qualified personnel, medical physicists, for immediate assessment and corrective action. 5. Documenting all findings, actions taken, and verification of successful recalibration. Question 13. Research into the characterization of a new linear accelerator's photon beam for therapeutic use requires a robust understanding of radiation physics principles. considering the need for accurate dosimetric data for treatment planning and quality assurance. Which of the following approaches best reflects the principles mandated by the European Society for Therapeutic Radiology and Oncology, ESTRO, accreditation framework for characterizing the beam's fundamental properties? Option A. Relying solely on ionization chamber readings taken in air to assess beam output and quality, without the use of a phantom. Option B. Performing comprehensive dosimetric measurements using a water phantom to determine depth dose curves, beam profiles, and output constancy across various field sizes and energies. Option C. Focusing exclusively on surface dose measurements to evaluate the beam's intensity and penetration. Option D. Utilizing simplified, non-standardized measurement techniques that prioritize speed over comprehensive data acquisition. The correct answer is B. Performing comprehensive dosimetric measurements using a water phantom to determine depth dose curves, beam profiles, and output constancy across various field sizes and energies. Explanation. This scenario presents a professional challenge in ensuring accurate and safe radiation therapy delivery, directly impacting patient outcomes and adherence to ESTRO accreditation standards. The core of the challenge lies in understanding and applying fundamental radiation physics principles to a practical clinical situation where subtle differences in beam characteristics can have significant consequences. Careful judgment is required to select the most appropriate method for characterizing radiation beams, balancing accuracy, efficiency, and patient safety. The correct approach represents best professional practice because it aligns with the ESTRO accreditation framework's emphasis on rigorous quality assurance and the use of validated, clinically relevant methods for beam characterization. Utilizing a water phantom for dosimetric measurements provides a standardized and tissue-equivalent medium, allowing for accurate determination of key beam parameters such as depth dose distributions, output constancy, and beam quality indices. This systematic approach ensures that the radiation delivered to the patient is precisely as intended, minimizing interpatient variability and maximizing therapeutic efficacy while adhering to established protocols for quality control. An incorrect approach that relies solely on ionization chamber readings without considering the phantom medium fails to account for the complex interactions of radiation with tissue. This can lead to inaccurate assessments of dose delivery, potentially resulting in under- or overtreatment. Such a failure directly contravenes ESTRO guidelines that mandate comprehensive dosimetric verification using clinically relevant phantoms. Another incorrect approach, focusing only on surface dose measurements, ignores the critical information about dose deposition within the target volume and surrounding organs at risk. This is a significant deviation from best practice and ESTRO requirements, as it provides an incomplete picture of the radiation field and its biological impact. Finally, an approach that prioritizes speed over accuracy by using simplified, non-standardized measurement techniques risks compromising the integrity of the quality assurance process. This disregard for established protocols and the potential for inaccurate data collection is a direct violation of the principles of safe and effective radiation therapy as expected by ESTRO. Professional decision-making in such situations should involve a systematic evaluation of available measurement techniques against the requirements of ESTRO accreditation and established clinical physics principles. This includes understanding the limitations of each method, the importance of standardized measurement conditions, and the need for comprehensive data to ensure patient safety and treatment efficacy. Professionals should prioritize methods that provide the most accurate and clinically relevant information, even if they require more time or resources, as patient well-being and adherence to accreditation standards are paramount. Question 14. Market research demonstrates that radiation oncology departments are increasingly investing in advanced linear accelerators and brachytherapy equipment. In this context, what is the most appropriate approach for a radiation safety officer, RSO, to ensure compliance with ESTRO guidelines on occupational exposure limits and monitoring for clinical staff? Option A. Rely primarily on the manufacturer's recommended shielding specifications for new equipment, and assume that adherence to these specifications inherently keeps staff exposure within acceptable limits as defined by ESTRO. Option B. Conduct personal dosimetry only for staff who report experiencing symptoms potentially related to radiation exposure, and perform environmental monitoring on an ad hoc basis when significant equipment maintenance is performed. Option C. Focus solely on ensuring that the total collective dose for the department remains below the annual limit stipulated by ESTRO, without specific attention to individual staff monitoring or the ALARA principle for specific procedures. Option D. Implement a comprehensive personal dosimetry program for all staff with direct patient contact. Conduct regular environmental radiation surveys of treatment rooms and ancillary areas, and establish clear protocols for investigating any personal dose reading that approach or exceed established action levels, with a focus on root cause analysis and corrective actions. The correct answer is D. Implement a comprehensive personal dosimetry program for all staff with direct patient contact. Conduct regular environmental radiation surveys of treatment rooms and ancillary areas, and establish clear protocols for investigating any personal dose readings that approach or exceed established action levels, with a focus on root cause analysis and corrective actions. Explanation. The scenario presents a common challenge in radiation oncology departments, balancing the need for effective radiation therapy with the imperative to protect staff from occupational radiation exposure. The core of the challenge lies in interpreting and applying the European Society for Therapeutic Radiology and Oncology (ESTRO) guidelines on occupational exposure limits and monitoring, which are designed to ensure patient safety and staff well-being. Professionals must demonstrate a nuanced understanding of these guidelines, recognizing that they are not merely a set of numbers, but a framework for a proactive safety culture. The correct approach emphasizes a comprehensive and proactive strategy for occupational exposure monitoring. This involves not only adhering to established dose limits, but also implementing robust personal dosimetry, regular environmental monitoring, and a system for investigating any excursions above action levels. This aligns with the ethical obligation to protect workers and the regulatory intent of ESTRO guidelines, which advocate for ALARA as low as reasonably achievable principles. By focusing on continuous improvement and a culture of safety, this approach ensures that potential risks are identified and mitigated before they become significant, fostering a safe working environment. Incorrect approaches fail to grasp the holistic nature of radiation safety, as outlined by ESTRO. One incorrect approach might focus solely on meeting the minimum legal dose limits without actively seeking to reduce exposure further, neglecting the ALARA principle. This is a regulatory failure as it falls short of the spirit of the guidelines. Another incorrect approach might rely solely on personal dosimetry without considering environmental factors or the need for systematic investigation of any deviations, which is an ethical failure to adequately protect staff. A third incorrect approach might involve infrequent or superficial monitoring, demonstrating a lack of commitment to ongoing safety and a disregard for the potential for cumulative exposure, which is both a regulatory and ethical lapse. Professionals should approach such situations by first thoroughly understanding the relevant ESTRO guidelines and national regulations. They should then implement a multifaceted monitoring program that includes personal dosimetry, area monitoring, and regular audits. Crucially, they must foster a culture where staff feel empowered to report concerns, and where any detected exposures are thoroughly investigated to identify root causes and implement corrective actions. This systematic and proactive approach ensures compliance and upholds the highest standards of occupational safety. Question 15. The evaluation methodology shows that when integrating radiation therapy with chemotherapy and immunotherapy, a critical step in ensuring optimal patient outcomes and safety involves a systematic approach to identifying and mitigating potential adverse events. Which of the following best represents this critical step? Option A. Implementing a uniform combination protocol for all patients without individualizing the risk assessment based on patient-specific characteristics. Option B. Conducting a comprehensive, evidence-based risk assessment that considers known toxicities, potential interactions, and patient-specific factors to guide treatment planning and supportive care. Option C. Prioritizing the potential for enhanced tumor response above all other considerations, including the increased risk of toxicity. Option D. Proceeding with combined therapy based on general knowledge of individual treatment modalities without a specific assessment of their combined effects. The correct answer is B. Conducting a comprehensive, evidence-based risk assessment that considers known toxicities, potential interactions, and patient-specific factors to guide treatment planning and supportive care. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a multidisciplinary team to assess the complex interplay of radiation therapy with chemotherapy and immunotherapy. The integration of these modalities introduces potential synergistic benefits, but also significant risks of overlapping toxicities and altered treatment efficacy. A thorough risk assessment is paramount to ensure patient safety and optimize treatment outcomes. Aligning with the European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation standards that emphasize evidence-based practice and patient-centered care. The challenge lies in balancing the potential for improved disease control with the need to manage and mitigate emergent toxicities. Correct approach analysis. The correct approach involves a systematic, evidence-based risk assessment that considers the specific agents used, their known toxicities, potential interactions, and patient-specific factors. This aligns with ESTRO guidelines that advocate for a comprehensive understanding of treatment modalities and their combined effects. Best professional practice dictates a proactive identification of potential risks, such as increased radiation recall, enhanced myelosuppression, or immune-related adverse events, and the development of strategies to monitor for and manage these. This includes pre-treatment evaluation, dose adjustments, supportive care protocols, and close follow-up. This approach is ethically justified by the principle of non-maleficence, do no harm, and beneficence, act in the patient's best interest, ensuring that the potential benefits of combined therapy outweigh the risks. Incorrect approaches analysis. One incorrect approach would be to proceed with combined therapy without a formal risk assessment, relying solely on general knowledge of individual treatment modalities. This fails to address the specific interactions and emergent toxicities that can arise from their combination, violating ESTRO emphasis on evidence-based integration and potentially leading to unforeseen and severe adverse events. This represents a failure in due diligence and a disregard for patient safety. Another incorrect approach would be to focus solely on the potential for enhanced tumor response, while downplaying or ignoring the increased risk of toxicity. This prioritizes a single outcome metric over a holistic patient assessment, which is contrary to ethical principles of comprehensive care, and ESTRO focus on patient well-being and quality of life. Such an approach could lead to significant morbidity that compromises the patient's overall health and treatment experience. A third incorrect approach would be to implement a standardized combination protocol without individualizing the risk assessment based on patient-specific comorbidities, performance status, and prior treatment history. While standardization can be beneficial, it must be balanced with personalized medicine, especially in complex multimodal treatments. Failing to individualize the assessment ignores the unique vulnerabilities of each patient, increasing the likelihood of adverse events, and failing to meet the ESTRO standard of patient-centered care. Professional reasoning. Professionals should adopt a structured decision-making process that begins with a comprehensive review of the evidence for combined modality treatment in the specific clinical context. This should be followed by a detailed risk assessment, identifying potential toxicities and interactions. Subsequently, a personalized treatment plan should be developed, incorporating strategies for toxicity monitoring and management. This process requires effective communication and collaboration among radiation oncologists, medical oncologists, medical physicists, nurses, and other allied health professionals, ensuring a unified approach to patient care that adheres to ESTRO accreditation standards. Question 16. Which approach would be most appropriate for a radiation oncologist to consider when developing a treatment plan for a patient with a known radioresistant tumor, aiming to maximize tumor control while minimizing normal tissue toxicity, in accordance with European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation principles? Option A. Prioritizing the use of the highest possible dose per fraction, regardless of the tumor's specific radiobiological characteristics or the tolerance of surrounding organs at risk. Option B. Significantly increasing the overall treatment duration with smaller daily fractions to allow for more cellular repair, assuming this universally benefits radioresistant tumors. Option C. Maintaining a standard, conventional fractionation schedule to ensure maximum safety, even if it means potentially compromising tumor control for a radioresistant tumor. Option D. Adjusting the fractionation schedule to deliver larger doses per fraction, based on the understanding that radioresistant tumors often have a higher alpha/beta ratio, thereby increasing the biologically effective dose to the tumor more than to normal tissues with lower alpha/beta ratios. The correct answer is D. Adjusting the fractionation schedule to deliver larger doses per fraction, based on the understanding that radioresistant tumors often have a higher alpha/beta ratio, thereby increasing the biologically effective dose to the tumor more than to normal tissues with lower alpha/beta ratios. Explanation. Scenario analysis. This scenario presents a common challenge in radiation oncology, where a patient's tumor exhibits a known radioresistance, potentially impacting treatment efficacy. The challenge lies in balancing the desire to achieve tumor control with the need to minimize normal tissue toxicity, all within the stringent accreditation and certification requirements of the European Society for Therapeutic Radiology and Oncology, ESTRO. Professionals must critically evaluate different radiobiological principles and their practical application to tailor treatment plans effectively and ethically. Correct approach analysis. The correct approach involves understanding and applying the principles of the linear quadratic (LQ) model, specifically focusing on the alpha/beta ratio and its implications for fractionation. A higher alpha/beta ratio indicates greater sensitivity to dose per fraction, meaning that tumors with a high alpha/beta ratio will benefit more from hypofractionation, larger doses per fraction, as the alpha component of cell killing dominates. Conversely, normal tissues with a low alpha/beta ratio are more sensitive to the beta component and thus benefit more from conventional fractionation, smaller doses per fraction to spare them. Therefore, recognizing a tumor's likely high alpha/beta ratio and adjusting the fractionation schedule to deliver larger doses per fraction, while carefully considering the tolerance of surrounding normal tissues, represents best professional practice aligned with ESTRO emphasis on evidence-based and patient-centered care. This approach directly addresses the radiobiological characteristics of the tumor to optimize therapeutic gain. Incorrect approaches analysis. One incorrect approach would be to maintain a standard, conventional fractionation schedule without considering the tumor's radiobiological properties. This fails to leverage the potential benefits of hypofractionation for radioresistant tumors, potentially leading to suboptimal tumor control. Ethically, it neglects the principle of beneficence by not employing the most effective treatment strategy. Another incorrect approach would be to indiscriminately increase the dose per fraction without a thorough understanding of the tumor's alpha/beta ratio or the tolerance of critical organs at risk. This could lead to unacceptable normal tissue toxicity, violating the principle of non-maleficence and potentially contravening ESTRO guidelines on dose constraints and safety. A third incorrect approach would be to rely solely on technological advancements without considering the underlying radiobiological principles. While advanced technologies can enhance dose delivery, they do not negate the fundamental biological responses to radiation. Ignoring radiobiology in favor of technology would be a failure to apply a core scientific principle essential for effective radiation oncology, potentially leading to suboptimal outcomes and not meeting ESTRO standards for comprehensive accreditation. Professional reasoning. Professionals should approach such scenarios by first identifying the specific radiobiological characteristics of the tumor and surrounding normal tissues. This involves reviewing patient data, relevant literature, and potentially utilizing radiobiological modeling tools. The next step is to evaluate different fractionation strategies in light of these characteristics, considering the trade-offs between tumor control and normal tissue complication probability. This decision-making process must be guided by ESTRO accreditation standards, which emphasize evidence-based practice, patient safety, and the optimization of therapeutic outcomes. A multidisciplinary approach, involving radiation oncologists, medical physicists, and dosimetrists, is crucial for developing and implementing the most appropriate treatment plan. Question 17. The review process indicates a potential discrepancy in the verification of dose delivery for a recent stereotactic radiosurgery (SRS) treatment course. Which of the following methods, when employed as the primary verification strategy for this SRS treatment, best aligns with the principles of ensuring accurate and safe patient-specific dose delivery as expected by the European Society for Therapeutic Radiology and Oncology Accreditation and Certification Framework? Option A. Relying exclusively on comprehensive pre-treatment machine quality assurance checks performed on the linear accelerator before the treatment course begins. Option B. Performing infrequent, non-patient-specific checks of the treatment planning system and delivery parameters at the beginning and end of the treatment course. Option C. Implementing real-time in vivo dosimetry using surface detectors or implanted sensors to measure the dose delivered to the patient during each treatment fraction. Option D. Conducting a retrospective dose reconstruction of the entire treatment course after its completion, without any during treatment measurements. The correct answer is C. Implementing real-time in vivo dosimetry using surface detectors or implanted sensors to measure the dose delivered to the patient during each treatment fraction. Explanation. The review process indicates a potential gap in the verification of treatment delivery for a complex stereotactic radiosurgery (SRS) plan. This scenario is professionally challenging because ensuring the accurate and precise delivery of radiation, especially for SRS where steep dose gradients are critical, directly impacts patient safety and treatment efficacy. Deviations, even minor ones, can lead to underdosing of the target or overdosing of critical structures, resulting in treatment failure or severe toxicity. The European Society for Therapeutic Radiology and Oncology (ESTRO) accreditation framework emphasizes robust quality assurance (QA) processes, and treatment delivery verification is a cornerstone of this. Careful judgment is required to select the most appropriate verification method that balances accuracy, efficiency, and patient burden. The correct approach represents best professional practice because it aligns with the ESTRO accreditation principles of ensuring accurate dose delivery through independent verification. Utilizing in vivo dosimetry, such as surface dose measurements or implanted detectors, provides real-time, patient-specific data during treatment. This method directly measures the dose delivered to the patient, offering the highest level of assurance that the planned dose is achieved. It allows for immediate detection of significant deviations and potential corrective actions, thereby minimizing the risk of under- or over-treatment. This aligns with the ethical imperative to provide safe and effective patient care and the regulatory requirement for rigorous QA. An incorrect approach that relies solely on pre-treatment machine QA without patient-specific verification fails to account for interpatient variability and potential setup errors during treatment delivery. Machine QA ensures the linear accelerator is functioning correctly, but it does not confirm that the dose delivered to the specific patient in their specific position matches the plan. This represents a regulatory and ethical failure, as it bypasses a critical step in ensuring treatment accuracy for the individual. Another incorrect approach that involves only post-treatment dose reconstruction without any in vivo measurement is also professionally unacceptable. While dose reconstruction can provide an estimate of the delivered dose, it is retrospective and cannot be used to correct errors during the treatment course. It lacks the real-time feedback mechanism crucial for immediate intervention and patient safety, thus failing to meet the ESTRO standards for comprehensive treatment verification. A third incorrect approach that relies on infrequent, non-patient-specific checks during a course of treatment is insufficient. While some level of periodic checks might be part of a broader QA program, it does not provide the continuous or near-continuous verification needed for complex treatments like SRS, where even small deviations can have significant consequences. This approach falls short of the rigorous verification standards expected for high-precision radiotherapy. The professional decision-making process for similar situations should involve a thorough risk assessment of the treatment technique and patient-specific factors. Professionals must consult the ESTRO accreditation guidelines to understand the mandated and recommended QA procedures. They should then evaluate available verification methods based on their ability to detect clinically significant errors, their impact on patient workflow and comfort, and their cost-effectiveness. The ultimate goal is to select a verification strategy that provides the highest degree of confidence in accurate and safe treatment delivery, in line with established professional standards and regulatory requirements. Question 18. The analysis reveals that in developing a radiotherapy treatment plan for a patient with a head and neck tumor, the radiation oncology team must meticulously consider the organs at risk or adjacent to the target volume. Which of the following approaches best reflects the ESTRO accreditation and certification framework's emphasis on OAR management and its significance in treatment planning? Option A. Focusing primarily on the OARs that are most likely to cause acute toxicity, while giving less attention to those that may lead to late effects, as acute side effects are more immediately apparent. Option B. Prioritizing complete tumor coverage with the prescribed dose, with OAR dose constraints being secondary considerations only if they do not compromise target volume coverage. Option C. Accurately delineating all relevant OARs according to established protocols and applying dose constraints that are evidence-based and aligned with current estro recommendations to minimize treatment-related toxicity. Option D. Relying solely on the default OAR dose constraints provided by the treatment planning system without specific consideration for individual patient anatomy or tumor characteristics. The correct answer is B. Prioritizing complete tumor coverage with the prescribed dose, with OAR dose constraints being secondary considerations only if they do not compromise target volume coverage. Explanation. The analysis reveals a scenario where a multidisciplinary team is developing a radiotherapy treatment plan for a patient with a head and neck malignancy. The challenge lies in balancing the prescribed dose to the target volume, with the need to minimize radiation exposure to critical organs at risk or in close proximity, such as the brainstem, optic nerves, and salivary glands. This requires a deep understanding of OAR tolerance limits, the potential for both acute and late toxicities, and the impact of these toxicities on patient quality of life. The European Society for Therapeutic Radiology and Oncology, ESTRO, Accreditation and Certification Framework, emphasizes the importance of evidence-based practice and adherence to established guidelines for OAR delineation and dose constraints. The correct approach involves a meticulous and collaborative process where the radiation oncologist, medical physicist, and dosimetrist work together to define OARs accurately, establish appropriate dose constraints based on current estro recommendations and clinical evidence, and optimize the treatment plan to achieve these constraints while delivering adequate dose to the tumor. This approach aligns with the estro accreditation requirements for quality assurance and patient safety, ensuring that treatment plans are not only effective, but also minimize the risk of unacceptable side effects. Incorrect approaches would involve neglecting the precise delineation of OARs, using outdated or inappropriate dose constraints, or prioritizing tumor coverage at the expense of OAR protection, without a clear justification based on the patient's specific clinical situation and prognosis. Failing to adhere to estro guidelines on OAR management could lead to increased toxicity, reduced patient quality of life, and potential noncompliance with accreditation standards. Professional decision-making in such situations requires a systematic approach. First, accurately identifying and contouring all relevant OARs according to estro guidelines. Second, consulting established OAR dose constraints and understanding the evidence supporting them. Third, iteratively optimizing the treatment plan to meet both tumor and OAR objectives. And finally, documenting the rationale for any deviations from standard constraints, particularly in complex cases. This ensures a patient-centered approach that upholds the highest standards of care and accreditation compliance. Question 19. Risk assessment procedures indicate that understanding the fundamental mechanisms by which radiation energy is deposited in biological tissues is paramount for effective therapeutic outcomes. Which of the following best describes the primary physical processes responsible for initiating biological damage in radiation therapy, as relevant to estro accreditation standards? Option A. The absorption of radiation energy by water molecules, causing a localized increase in temperature that denatures proteins. Option B. The scattering of radiation particles off cell membranes, altering their structural integrity without significant energy deposition. Option C. The generation of free radicals through the photoelectric effect, which then directly interact with DNA. Option D. The direct transfer of kinetic energy from incident photons to electrons, leading to ionization and excitation of atoms and molecules within cells. The correct answer is D. The direct transfer of kinetic energy from incident photons to electrons, leading to ionization and excitation of atoms and molecules within cells. Explanation. The scenario presents a common challenge in radiation oncology, ensuring the safe and effective interaction of radiation with biological tissues, which is fundamental to treatment efficacy and patient safety. The challenge lies in understanding and controlling the complex physical processes that occur at the cellular and molecular level when radiation is delivered, and how these processes translate into therapeutic outcomes and potential side effects. This requires a deep understanding of the underlying physics and biology, coupled with strict adherence to the European Society for Therapeutic Radiology and Oncology, ESTRO, accreditation and certification guidelines. which emphasize quality assurance and patient-centered care. The correct approach involves a thorough understanding of the primary and secondary radiation interactions with matter, specifically focusing on how these interactions lead to ionization and excitation within the target tissue. This knowledge is crucial for optimizing treatment planning, ensuring accurate dose delivery, and minimizing damage to surrounding healthy tissues. ESTRO guidelines mandate a robust understanding of these principles to ensure that radiation oncologists and medical physicists can effectively predict and manage the biological consequences of radiation therapy, thereby upholding the highest standards of patient care and safety. Incorrect approaches fail to adequately address the fundamental physics of radiation interaction. One incorrect approach might focus solely on the macroscopic dose, delivered without considering the microscopic mechanisms of energy deposition and subsequent biological damage. This overlooks the critical role of ionization and excitation in initiating the chain of events leading to cell death or damage, which is a core tenet of radiation biology and physics as applied in ESTRO standards. Another incorrect approach might prioritize technological advancements without a foundational understanding of the underlying physical principles, leading to potential misapplication of equipment or misinterpretation of treatment outcomes. A third incorrect approach could involve relying on empirical data alone without a theoretical framework, which limits the ability to adapt to novel treatment techniques or unexpected radiobiological responses, and deviates from the evidence-based and scientifically grounded approach promoted by ESTRO. Professionals should employ a decision-making process that begins with a comprehensive review of the physical principles governing radiation-matter interaction. This should be followed by an assessment of how these principles directly impact the intended biological effects in the patient, always referencing the specific quality assurance and accreditation requirements set forth by ESTRO. Continuous learning and critical evaluation of treatment outcomes in light of these fundamental principles are essential for maintaining professional competence and ensuring patient safety. Question 20. System analysis indicates that a patient with a history of severe cardiovascular disease and recent onset of diabetes is being considered for adjuvant radiation therapy following surgery for a localized malignancy. Which of the following approaches best aligns with the principles of patient assessment and selection for radiation therapy under the European Society for Therapeutic Radiology and Oncology Accreditation and Certification Framework? Option A. Defer radiation therapy until the patient's diabetes is better controlled, without a detailed assessment of the immediate oncological urgency. Option B. Proceed with radiation therapy as planned, assuming the oncological benefit outweighs any potential risks associated with the patient's comorbidities. Option C. Conduct a comprehensive risk-benefit analysis that thoroughly evaluates the patient's comorbidities and their potential impact on radiation tolerance and treatment outcomes, alongside the oncological indication. Option D. Focus exclusively on the stage and grade of the malignancy to determine eligibility for radiation therapy, with minimal consideration for the patient's overall health status. The correct answer is C. Conduct a comprehensive risk-benefit analysis that thoroughly evaluates the patient's comorbidities and their potential impact on radiation tolerance and treatment outcomes, alongside the oncological indication. Explanation. This scenario presents a professional challenge because the decision to offer radiation therapy involves balancing potential benefits against significant risks, particularly in a patient with multiple comorbidities. The European Society for Therapeutic Radiology and Oncology, ESTRO, Accreditation and Certification Framework emphasizes a patient-centered approach, requiring a thorough risk-benefit assessment that considers not only the oncological indication, but also the patient's overall health status and potential for treatment-related toxicity. The correct approach represents best professional practice because it aligns with ESTRO guidelines on patient assessment and selection, which mandate a comprehensive evaluation of a patient's suitability for radiation therapy. This includes a detailed review of their medical history, current health status, and the potential impact of radiation on their existing conditions. The goal is to maximize therapeutic benefit while minimizing harm, ensuring that the treatment offered is both effective and safe for the individual patient. This approach upholds the ethical principles of beneficence and non-maleficence, ensuring that the patient's well-being is paramount. An incorrect approach that focuses solely on the oncological diagnosis without adequately considering the patient's comorbidities would be professionally unacceptable. This failure would violate estro emphasis on individualized treatment planning and could lead to significant patient harm due to exacerbation of existing conditions or unmanageable treatment side effects. Ethically, it would represent a breach of the duty of care by not performing a complete risk assessment. Another incorrect approach that prioritizes aggressive treatment at all costs, disregarding the patient's quality of life and potential for severe toxicity, would also be unacceptable. This disregards the principle of patient autonomy and the importance of shared decision-making, where the patient's values and preferences are integral to the treatment plan. Estro guidelines promote a holistic view of patient care, extending beyond tumor control to encompass overall well-being. The professional decision-making process for similar situations should involve a multidisciplinary team discussion, including oncologists, radiation oncologists, medical physicists, and nurses. This team should meticulously review all available patient data, conduct a thorough risk assessment, and engage in open communication with the patient and their family to discuss all treatment options, including the risks and benefits of radiation therapy, as well as alternative or palliative care approaches. The final decision should be a shared one, based on the best available evidence and the patient's individual circumstances and goals of care.